I'm Brian Lane. I'm the President and CEO of the Center for Health Affairs and CHAMPS. Thank you for coming in and representing all the different sectors of our community, academic leaders, healthcare administrators, community members, clinical instructors, nursing professionals, and then what you're going to hear is we have a tremendous amount of deans here. So each of you has chosen to be here on Friday morning because of your own personal deep commitment to making a meaningful difference here within our healthcare systems, but also within our community. Together, we have the opportunity to make a profound impact and help bridge the gap between both education and practice in the healthcare setting. I sincerely thank all of you for joining us today. We're proud of the work in partnership with the Greater Cleveland Organization for Nursing Leadership, GCONL. Give them a hand. Arm circle, nope. Okay, to present today's roundtable event and bring together experts from both academia and industry to explore key issues related to many challenges of a career in nursing. GCONL is a vital partner to the Center for Health Affairs, united by a shared commitment to strengthening our healthcare workforce. As an organization dedicated to advancing the nursing profession, GCONL plays a key role in supporting the very professionals who make up the backbone of our hospitals and our healthcare network. With workforce development being a top priority for the center and for the hospitals and the healthcare system as a whole, this partnership is essential to ensuring a strong, resilient, and thriving healthcare system for our region. And that's due to all of you. As we all know, nurses are at the front lines of healthcare, managing high-stress situations, long shifts, and complex patient needs. And there's much more to that. Some of the many questions that will be discussed today directly address these challenges. First off, how can we better prepare nurses for the demands of today's clinical settings? What innovative solutions are being implemented to address faculty shortages as well as clinical site limitations? And how can academic institutions and healthcare systems, via partnership, create stronger and long-term partnerships to support nursing students and early career nurses? Innovative thinking around these specific questions is vital to achieving better health for our community. Without a fully staffed and capable workforce, we all will experience the negative effects of a workforce being stretched too thin. Putting together this roundtable, and I want to give thanks to everybody who had a hand within it, we're collectively working together to educate and build solutions that can lead to more sustainable workforce, continue to advance quality and safety, and support the well-being of those who are essential to the functioning of our healthcare system. Being here today, you're showing that commitment to building a stronger and safer, healthier community. Today, you will have the opportunity to learn, network, and potentially acquire some new ideas that could benefit not only the healthcare workforce, but our community at large. By gathering this roundtable of experts and industry leaders, we are encouraging open communication and dialogue. So what that means is, throughout all of our roundtables, we want you to participate, okay? When possible, share your experience, express your concerns openly, be respectful, and most importantly, discuss possible solutions. To help make that possible, we have an incredible lineup of speakers from different areas of emergency management, including Dean Patricia Sharpnack, the Breen School of Nursing and Health Professions, Ursuline College, Dean Wendy Wilson, Nursing Cuyahoga County or Community College, Dean Melissa Cole, College of Health, John Carroll University, Julia Bartle, Chief Clinical Officer, Hospice of Western Reserve, and Meredith Fox, Senior Vice President, Chief Nursing Officer, Cleveland Clinic. And this impressive roster of panelists will be moderated by Erin, the Associate Dean, gotta have another Dean, of Central School of Practical Nursing, with more than 2 decades of experience in healthcare operations, nursing leadership, and workforce development. She's championed innovative approaches to workforce development, creating pathways for individuals to enter and excel in the healthcare arena. I'd like to express my sincere gratitude to Erin and to each of our panelists, not only in dedicating their valuable time to us today, but also for their leadership in advancing our shared goal of fostering a stronger and safer healthcare community. By generously sharing your knowledge and expertise, you enrich all of us. Together, there is much we can learn from one another, And as the healthcare industry continues to face workforce shortages and challenges, it's up to the leaders within our community, including all of us here, to collaborate, generate new ideas, and seek out solutions that can address this evolving healthcare landscape. Let's also look to the future. How can we encourage our younger generations to enter the healthcare field? How can we ensure that they are supported and prepared for success? And before we get started, I want to emphasize the significance of forging new connections. That means with each and every single one of you at your tables, as well as with one another during this event, but also afterwards. You should recognize the profound value of relationships within your profession, as well as within this community. Today, when possible, please share your insights. As I stated before, offer your expertise, learn from one another, and be inspirational. The solutions to these challenges are within this room. Each of you has the knowledge that can help change the healthcare industry. Let's work together. I call it 1 + 1 = 6. Before I turn it over to Erin, I'd like to take a moment to extend a big thank you to our sponsors, Central School of Practical Nursing, Luna Bakery, Ursuline College, Xavier University, Adaptive Workforce Solutions, and Champs Group Purchasing. Your generous support made this possible to get today, and we're grateful. I also want to say thank you to my staff and team. I know it's been a crazy morning, especially with the elevator. You've all kept calm and cool, and I'm very proud of that fact. And to everyone in the audience who got a tremendous workout earlier this morning, bless you, and thank you for being here. And I hope you'll find that this roundtable is beneficial. Thank you.
Thank you. Thank you, Brian. Those of you that know me, I can't believe they gave me a microphone this morning. So exciting. If I'm really cool, okay, a short person always does this, regardless if you adjust the microphone or not. So it's just easier for me to hold it. So first and foremost, good morning. I want to congratulate all of you. You have done something today that you didn't know you were going to do. You passed your cardiac stress test. Yay you for doing that. 4 flights of stairs, no joke in the morning. But just imagine the 4 flights down, much easier. Just be sure-footed, please. We don't need anybody to fall. I want to certainly thank the Center for Health Affairs and the GCONL for giving me the opportunity to join all of you today in the audience, but certainly the esteemed panel. It is incredible when you can see your life's journey here in front of you and know that the individuals that you get to work with every day get to be on a panel and you get to ask them questions. So happy to see all of my colleagues here this morning. As we start to talk and as we were starting to plan this event, we had some conversation. And we were trying to decide on the topic for today's roundtable. And what did we start with? Let's talk about vacancy rates. Let's talk about turnover. And let's talk about why we don't have enough clinical staff to educate all of our future nurses. Riveting, right? That's what you all wanted to come and talk about, right? It's a topic we've never talked about. And fortunately, I have a great panel that kind of went, we don't want to talk about that. We don't want to do that. We've all done it. We all live it every single day in one way or another. These are conversations that you continuously have. So these were not conversations that we wanted to continuously have. So we wanted to shake it up just a little bit. So we want to talk about the pathway to our profession, entering from a nursing student even before, coming into nursing, the excitement that is built within all of our colleges, universities, and schools. And then how do we then seamlessly transfer? It's the handoff, right? We all know about those. It's the handoff then that we have to our healthcare systems. And then here you go, the bright, shiny thing we just gave you. How does that work for you? And how can we then work together as academics and as the healthcare workforce and healthcare systems? How can we come together to help bridge that transition as seamlessly as we can for our nursing students so that we will have, I hope to one day never have a conversation about retention again and turnover. It's my goal that one day we don't talk about that anymore. And if we do this well, we can start building environments where we don't have as much of that. It's a hope. So I want to start here for just a second as we talk about pathways into our profession. If I can ask, this is the audience participation part. If I can ask how many of you entered your nursing journey as a BSN? Phenomenal, hands down. How many of you started it as an associate's degree nurse? I can raise my hand, large and proud. Cool. And how many of you started your nursing profession journey as a diploma grad? Well, look at that. Look at the many pathways we have to enter our profession. Isn't that wonderful? No wonder we have the conversations we have about the transfer into the workforce, right? And how many of our health systems hire ADN, diploma, and BSN grads? You do it all, right? And now you don't have one size fits all, or do you, when you enter into the profession? So that's just a little nugget to think about, right? We all know that the pathway into our profession is different and varied, but we also know that everybody enters it differently because of their own life circumstance. And then we know that those that have diplomas in nursing can go on and be incredibly impactful and powerful nationally and internationally. Sorry, I point to Dr. Pat Sharpnack, right? That is a member of the NLN, has done things with the ICN and other things, right? So it doesn't mean that those that enter in through a diploma won't go on to someday impact our nursing profession. So what can we all do as professionals and help garner and support and transition our own profession? Here's another question. What is the largest group of patients that we all know? It's not male or female. It's not older adults. I have identified a new group because we can talk about it this way. Our nurses and our nursing students are the largest group of patients that we deal with every single day. If we start to think about our nurses and our students as our patient and keeping them at the center, because that's what has motivated us for all these years and why we do what we do, boy, could we do some pretty exciting things for them. Just another food for thought. Okay, let's get into the conversation. Isn't it nice to know that it wasn't older adults? Oh. We're just getting closer and closer every day, right, to that group, and I don't want to be that group, so it's kind of nice. So as we start to talk, and we are going to address really 5-6 key areas of focus in our conversations today, and we're going to be talking about the fragmented pathway. How can we help support those nursing students transition into bedside or nurses in the organizations? Building resilience, this is one of my favorite topics, because resilience may not be, I don't know that we all have the same definition, so that's always interesting. Understanding innovations. For some of our panelists, innovation may be their middle name. Could be. And we'll walk through that. Understanding workforce development, career paths, and then what does the future of nursing education look like, and how can policy help support the things that we need to make sure that we have the best education process moving forward for our nurses. So, my esteemed panel, as we start our conversations today, I'd like for us to talk about what you see, and I'm gonna go to Meredith first. You ready?
Sure.
Okay. You didn't know, I know. They didn't know where I was gonna go first. What you see is the biggest transition barrier when you're seeing nursing students coming in. Now, it could be into the Cleveland Clinic or it could be into workforce. It could be kind of however you see that. And what are some of the things that maybe you all are doing to address that? So what are the barriers and maybe some ideas that you're doing to help address that?
So when I think about the transition from whatever part of their schooling it is, and when we think about ourselves as transitioning from student to professional practice, whatever program that is, so if it's LPN, RN, I think the idea, it's pretty simple. It's the reality that all of a sudden it's their responsibility, and they don't have the perception of thinking that they have to do it all on their own and closing it off in terms of, now I'm the licensed person, now I'm not a student, I don't have this team to go to. And I think we have to transition that to ensuring that they understand it's still a team sport and that they still have folks around them, whether they're, day one of their practice, year 10 of their practice, that we have others that we're always going to rely on for advice, for expertise, for how to do that. And we have to instill in them that I said to a group of nursing students that are transitioning, all as new grads here soon, I said, you have to know you have competence. You made it through the program. You passed the licensure exam. We got you here. You have to have that competence. You have to also be humble when you transition, and you need to not be afraid and not be fearful of what you're going to be taking care of, because that can set you back and hinder you from being able to take great care of patients and rely on others. I still think we have a challenge with embracing new graduates, because people are very kind of center focused on what they need to do, and we still have to focus on how we can help everyone. I think what an opportunity for us as academics and clinical is to figure out how we bridge that better at the end of programs, because it's hard at the beginning. We're teaching foundational skills, we're teaching foundational knowledge, and then how do we at the end be more close-knit together through that education journey, so it's not just a handoff from the ED to the inpatient unit or to the ICU in a time of crisis, that we are working together through those handoffs.
No, that's perfect. Thank you so much. Other of our panelists want to weigh in?
I'd be happy to. I'd like to do two things. One,
Yes,
you
ma'am.
talked about me being on the National League for Nursing, as well as the International Council of Nurses. And I just want, before we get more in depth about this, I want to congratulate this region, because there is nothing like what we do in this Cleveland area and Northeast Ohio that exists anywhere else that I have seen internationally or nationally. The dialogue that we have between practice and academia here is intensive and great. I mean, there's this sense of continuum. So before we talk about where there are the gaps, I want you to know just one of the brightest things that I have learned is the fact that we are so unique compared to every other area. So thank you to my practice partners and to my academic partners, because it is much different elsewhere, much more siloed. But I would concur with what Meredith has to say, but I also want to say that our clinical experiences are part of the reason we have that issue. We do our clinical experiences in somewhat of a silos, I want to say, because they have these clinicals, but they're not really experiencing the true role of a nurse. And we can't have students transitioning to the graduate role prepared unless we mimic that a little bit better. We scaffold it. It can't just be in that last 180 hours or 240 hours. They have to be doing this from day one, where they understand this is my responsibility. I'm working with a nurse. And I just recently wrote a paper that will be published about the importance of the staff nurse. No one means more to students than your staff. The research out there says they transition better if they have more contact with staff nurses. And considering you're short-staffed and your nurses are burned out, that is one of the challenges that we have to face, is how do we get our students intertwined more with our staff nurses, understanding that clinical role a little bit better, because I think if we can do that, scaffold it over time, and provide a clinical experience that really does mirror your responsibility as you transition, I think will impact both their resilience as well as their transition into the practice role.
It's great. How many of you have residency programs for your new graduates? Awesome. That became a very popular thing to do. Probably, I don't know, I've done this for a long time. So if I start dating myself, that makes me old. But probably a good 20 years ago, I think they started, right? And I would imagine that many of those really haven't changed a whole lot. I mean, you tweak them. I'm not saying that you don't, but I think this is the other conversation, right? So residency programs are great, but sometimes because we have people coming in through different pathways and their experiences and their clinicals have been different, then the residency program, although you've built amazing residency programs, don't always meet where the student is or the new graduate is when they come into your area. So I think that's an area that maybe we can powwow about in the future, right? And giving us little breadcrumbs about other conversations that we're going to have. We're not going to sell all the things today. Melissa, do you have a thought? I see you engaged and ready to say something to me. Okay.
Well, just to build off, I think what Pat was saying is, one of the things our physician partners do in their training and learning is, many of the physicians are expected to teach consistently. They're practicing, they're teaching, they're practicing, they're teaching, especially in academic medical centers. I think in nursing, it's not an expectation when we become a staff nurse that a portion of our job is teaching. And so one of the things we've tried to do with our health systems is to lease clinical faculty from them instead of hiring them at John Carroll individually. So we're borrowing, if you would, full-time and part-time staff nurses to connect them better. They work on the unit, they build that better relationship. Our hypothesis is that one, if you're teaching the future nurse of tomorrow, hopefully you're feeling a sense of purpose and connection to the why, which will help you stay at the bedside. Two, I'm not hiring you, so hopefully I'm not pulling you away from the bedside. And two, what we're finding from the nursing students who have a leased faculty rather than a hired faculty, and we have both models, is they have a much better experience on that unit because they feel connected to the staff, they have more opportunities, they feel part of that team, and they're not as fearful, I think, during that rotation, and they seem to have a better experience. So we did an initial publication in the journal Professional Nursing a few months back now, and we're gonna continue to track this and study it to see. But I think if we can get more to a model where we are engaging both clinical staff with the students in a way that it becomes part of what we do, I think it'll help us scale. I think it will improve the experience for the nursing student and help with that transition a bit more.
Yeah, I think it's great, and I'll share a little bit. At Central School, what we found when I walked into the organization with, I'd be remiss not to call out Ann Kalenic, our dean. And as we walked in last year, what we found is our students were having clinical experiences probably in more observation than actual hands-on clinical pieces. And Ann and I both went, oh, no, that will never do for us. So what we did is I found a wonderful partner for our community rotations for our LPNs, and we wanted to make sure that our students saw other LPNs working and were able to work side by side with them. And my partner's in the room, and it's Ken DePippo with UH's Home Care. So we set up an amazing rotation. It takes a lot of work to organize students to go to home care, I just thought I'd tell you, because they're all over the city. And we had such resistance from our students. It's actually one of the favorite things for me to tell them that they're gonna go do, because they're like, oh no, not me. I'm not going into someone's home, and I'm not riding with some stranger in their car for 8 hours, not doing it. And I thought, well, okay, but you will. And so every time they do the rotation, I get scads of emails from the students that say, oh my gosh, I got to today. They let me do this today. Wound care, boy, we're really good at wound care because we've been doing it. And this is the better part of the story. Ken, how many of our students have you hired? At least three, and there's a couple more in this class that's getting ready to interview to go with them. So this is a wonderful pipeline and collaboration where we get to send our student with that nurse, right, side by side, and they get to learn from them. And it is incredibly enriching. So not always easy to do, but I think it is one of the innovative approaches that as academia and workforce that we can work together to see if we can do that. Wendy, anything that you want to add?
Sure. I think that the opportunities that you and Melissa just described are, excuse me, are also mirrored in the fact that when new graduates arrive and we talk about nurses that are existing are busy and are stretched and need to have experiences with those new grads to help them feel part of that culture, it's important that we help to tell our nurses that they are important part of the future of nursing. Yes, they're tired and stretched, and this new graduate is, for lack of a better term, burdensome, but they were once that nurse. And the only way that our profession will proliferate and continue to grow, and they will no longer feel burdened and stretched and tired, is if we continue to grow and allow new graduates to come and learn and be able to see how they function on their unit, be able to be a part of the culture, be able to learn from them and their experience. And so while yes, it is hard to have a new graduate, it is about that transition to practice and being able to see themselves as that once new graduate. It is a piece that will always exist. And so sometimes it just is a matter of allowing that connection to be made. It was something that I had written down when the gentleman was speaking in his opening remarks, forging connections in this room. But it just was a takeaway that I had, just forging those connections, because it is about connecting. And so for us in academia, that is something that we try to instill in our students to say, yes, you are going out in becoming a new graduate, but you will be part of that culture. So as we tell them you're kicking the tires on these units as you're in clinical. And so they see people and behaviors and things that they do or don't want to be a part of. And so on the flip side of that, we want to encourage folks that are out on the units to understand that they're being watched too. And that is something that is that the nurses should be aware of as well. As they come onto the units, those new graduates, they want to be a part of something, and if they're not feeling welcome, that is where that friction will come.
I think Judy Beeler says it well. She once told me it was one heck of a long interview on both sides. So you get to see the student before they come, but the student gets to see the clinical site before they come.
Yep.
I heard
I just
that.
think the expectation should be that when a group of students, a student comes to a nursing unit, a community setting, a clinic, that they're part of that team. It's not, they're not guests anymore. They embrace them as part of the team, and the experience is going to be better for all.
Yeah, I think it's great. And I will say from an academic perspective, and I believe most of us do it, but I've heard some don't necessarily start their day at the same time that the nurses start their day, right? That they come onto the unit at 6:45. So they are ready for their assignments and ready to be in report. I've been known maybe to send a student home maybe if they didn't attend report. You weren't ready and you weren't there for the day, and now you don't get to stay. So there's part of that, right? That as we're starting to introduce our students into the workforce to then work side by side with our nurses, I think there's that expectation as well, right? Yes, you're the student, but you are there to be a part of the team that day. So just one of those items. So as we start to have a little bit more conversation, this becomes one of my favorite topics, and it's resiliency. How many is tired of the word be resilient? We are resilient. We're the most trusted profession because we're resilient. Anyhow, resilient becomes that like, oh, geez, I hope we talk about it a little bit more. And when we were talking and planning our sessions, we said, we want to build resiliency. And Michelle Hereford, who couldn't be here with us this morning, said, what do you mean? What do you mean by resiliency? I thought it was great. I'm like, leave it to Michelle to pause us all and go, what is it that you're really talking about? And I thought, fair. And so as we started to unpack that a little bit, we started to talk about emotional resiliency. And we all know, we've been nurses for a long time, as we entered the profession and as we work every day in it, that we bring our own emotional selves, whatever that is, our journey of ourselves, to work every day. And then we're working with our patients, their families, our coworkers, and all of their things too, right? And how do we make sure that we can help our future nurses and our nurses be able to work through their own emotional resilience and support them, and recognize that it's not all about putting things in compartments. How many of us are taught that you compartmentalize, you don't take on the emotions of your patient, be very this way, that way, right? That doesn't really work that well. So how do we help our students become more emotionally aware of what they need to do, understanding their trauma? We talk about it as trauma education, understanding the influences of trauma. And how do we help them become more emotionally resilient to help them then enter a field where it's all about emotion? Thoughts about what you guys are doing around that? Melissa, do you want to share?
Sure. Yeah, we thought about this, as a new BSN program, and seeing also generational differences, I think, in this generation that's coming up. And, we're naming things like anxiety and depression and really needing to, how do we name emotional resilience? How do we prepare it? And part of that is, some of it's creative problem solving and empowerment, and some of it is like, what is moral distress? What is burnout? So we actually partnered with our counseling center and our counselors on campus to say, how could we integrate a curriculum, of 15 hours through a 3-year period or something, where we could begin to prepare a toolbox for our nursing students that while we have them, how can we help them build emotional resilience, understand what personal self-care looks like, how do they learn to put their oxygen mask on so they can take care of others, what does that look like? And so we built about 15 hours, we give about 5 hours a year. It's integrated into the nursing curriculum, where we focus on specific nursing resilience. We also then partnered with our Bowler College of Business on innovation and entrepreneurship principles. And we think that those are really important, like how to fail. What is, I think as nurses, we're recovering perfectionists, or I know I am. But how do we teach them how to fail? How do we teach them that that's a part of learning? How do we teach them creative problem solving? When you see this barrier, how do you see it as an opportunity? And so we have some experts coming in on the business school to kind of talk about some of those fundamentals. So we really look to, I think in nursing, we're not always the experts in some of these areas, or I didn't feel like I was, and how do we partner across disciplines to really bring in content, I think, that can help better prepare what we call the power skills of the future nurse.
Yeah, it's great. Thank you. We have certainly spent a lot of time thinking through it, right? And I think we're all still kind of doing that. Pat or Wendy, do you want to share what you're doing at Tri-State? We'll start with Wendy first, then we'll go to Pat.
Well, nothing specific. What I was going to say was, I think what is important that we have found is, especially being at a community college, is firstly just recognizing where your students come from. In our population, they bring with them a lot of things. And so when you talk about resiliency and self-care and mental wellness and those sorts of aspects, we first have to make sure that we understand what our students are carrying with them to class every day. And so we have brought in our counseling faculty and deans to talk at our orientations about the resources that we do have available to them, because that is something that is important for them, because students are very they're very proud. They don't often share, and we sometimes find out when it's too late that things are happening. Students have lost their homes. They're fleeing domestic violence situations. They have brought parents over from war-torn countries. I mean, the list goes on and on. I mean, and these are real examples from my program. And so they're doing this to better themselves, their family situations. And so they're trying to do this along with the rigor of our programs to become a nurse. And so that, I think, when you talk about the emotions of now once they become nurses and the emotional stress and dealing with patient care, they've been through that. So now you have this element of, how can I be an advocate because I've been in that situation? So it's not necessarily always about resiliency for some folks. It's about that advocacy piece And how can I now be an advocate and a partner and a voice for my patient, because I have been in that situation and I know how to navigate this situation. So for us, it's about helping students on the front end become resilient, have that grit, and persevere so that they can become a nurse.
That's fantastic. Thank you so much for sharing, Pat.
I would add to Wendy's, and I don't think it's isolated to associate degree programs. Ursuline College is very committed and mission-oriented to serve our population here in Cleveland. So what I would add to Wendy's is that a lot of these students have a great deal of trauma in their life. They are trying to survive day by day by day. These are not students who can afford to be in nursing school, but they want something better for their lives. And most of the time, they feel like imposters. They feel like they're not supposed to be here, they don't belong here, and any barrier that comes in their face ends up with them quitting. So adding to what Wendy said, we have a lot of wraparound services. We've educated our faculty on trauma-informed teaching. How do you reach these students so that you can impact them and help elevate where they're at right now? Second thing is also making certain that what we're doing is reflective of what we're practicing. Agree, you're gonna fail, number one. Number two, it's not all unicorns and rainbows for any job you're gonna have in your life. Whether you're welcome to Walmart or you're in a professional nurse's role, it's not going to be unicorn and rainbows. So it's orienting them to the fact that there are good days, there are bad days. There are wonderful experiences that you'll have as a nurse, but there are going to be some traumatic times as a nurse. So getting them used to that, so when they're in the clinical arena, that debriefing piece is really key to preparing them for transitioning to the full RN role. So I would say wraparound services, definitely, trauma-informed care or trauma-informed teaching, and also making certain that you're aware that barriers for these students really are significant, and they quit. And if they're not quitting, actually, they're quitting mentally. So making certain that you're, I don't want to say in their faces, but pretty much be in their faces so that you can give them the guidance and support that they need.
I would just like to add, and then I think Judy, as a clinical partner, I think then that's our responsibility to continue those type of activities and behaviors when they transition to us, because we can't stick with our nursing professional norms of stick it out, don't go to the bathroom, don't eat lunch.
Right.
If they had wraparound services as a student and then they get to us and it's tough love and you just have to work. Well, yeah, of course they're gonna quit. Be like, I had these supports. So we have to make sure we continue that and challenge some of these professional norms from the student to practice, because we're fighting the same thing. Some of those things don't change for them when they transition to practice, and I think it's up to us to challenge some of these professional pieces, because if they were supported as a student and we don't support them there, they're not going to be successful either. I don't know, Judy.
Judy, I was just going to say, yeah.
Yeah, well, I think you can all imagine in the field of hospice and palliative care, I'm not saying you don't know how to do, but the amount of resiliency you need to do that job, because this is it. Patients don't get another chance to do it. Families don't get another chance. You really don't get a chance to fail in this, because then you've failed somebody's life, grief, work, if you don't do this right. But they're carrying all that of families on them. And it used to be in hospice, and this was nationally, no hospice would ever take a new grad, because they've never even gone out and documented on their own. They've never really seen patients. They've definitely not gone in people's homes, but we had to change, 15, 20 years ago too, and start thinking about the nursing shortage and, can we afford not to teach people how to do this right out of school? And it's not, when I heard someone say younger generation, it's in hospice and palliative care, we often get the people as a second career. They felt like they did need to go learn the basics of nursing, but now we are getting some right out of school, and to teach them, we have all kinds of stopgaps for support groups and things, but nobody has time. Nobody wants to, they've already missed their lunch, and they don't want to spend time away to get the help they need, and so they're carrying on all the burden of losing people, the constant grief. So we do a lot with grief work for our staff because the accumulated grief is intense for them. And we talk a lot about novice and expert roles, and that's Pat Benner, Nursing Theorist 101. And nurses get out and everybody in the community thinks they know what they're doing, and especially going into hospice, they don't really know yet.
Right.
And we're taking them, we're doing year-long residency programs as well, but I like what you said about, somebody said 2-year program. I think we quit on them too soon, probably, and I'm learning a lot from all of you on what we could do better and different, because our turnover rate never used to be an issue. People came and stayed till they, like me, till they retire, but they don't do that anymore, so.
Well, I think it's what we've already brought up from the panel is, I love this conversation. You'll see that this is like a passion of mine. Trauma-informed education is kind of where we're going, because we're seeing, on average, just the students that we see at Central, they have gone to 2.5 other programs. Not because they're not smart, has nothing to do with their ability to do the coursework and the technical work that they have to do. It has, because they all have to pass entrance exams to get in, right? And they all have to have certain GPAs and all of that. It is truly about their life stresses that impact them. Chris Young and I were having a little conversation this morning and about what you're doing in Akron, right? And how you're supporting students coming in and then your employees going to schools too. And it's not their ability to learn the material. It's really all this other life stuff that they're managing. I know that the students in our program, they're graduating. When they graduate, they will earn a life-sustaining wage, meaning I can take care of one person on my salary when I graduate. RNs graduate with a family-sustaining wage. Now I can take care of me and maybe 1 or 2 others. Maybe not a whole gaggle, but that's what I'm starting to do. But I have to manage all of these other stresses along the way and all of that past trauma that I've had from failures. And the last thing I want to do is to fail again. And I think understanding from the academics, the things that we're doing to try to help address our students is really good for our healthcare partners to know, dude, we're putting a lot of time into the health and the social emotional beings that we are providing to you then in the nursing workforce. I can get on a soapbox about EAP programs and things like that in hospitals, right? And employee assistance programs, and how as a nurse leader, I use the employee assistance program all the time. But not everybody has that in your repertoire to offer to your employees. So now it's, what do you do to try to help? And I think that's one of the things. So I love that you brought it up, like, well, geez, if you guys are doing all this over here, don't send me somebody that you've given the world to and now I don't, or all of those supports, because that may be a reason why we're seeing some of the turnovers that we see, because they just don't have the link in to the emotional social supports that they were used to seeing before.
I have a question, though,
sense?
too,
Please.
for the panel
Yeah.
here. The one thing, though, that I'm not seeing for the past 6, 7, 8 years coming out of nursing, when we do get these new nurse residents, I'm not seeing a degree of professionalism in them. So I'm, doing all this, and I was talking to Laura about this. I don't
Love
know
it,
if
Judy.
that's
Way to
generational.
just bring it right down.
I mean, I hate to say it, but I don't know if that's something you learn at home, or Laura and I were talking about, or is that something you learn in school?
It is something you learn in school. and
Okay,
it is-
so we
it
need
is
more
a
of it.
struggle for us. I will tell you, I tell my students, and actually, this is so timely because I was meeting with a student yesterday who behaved badly, sharing too much information in a clinical site, and was called in on it. So we removed her from the clinical site and wanted her to read some literature and reflect on how could she be more professional. So I met with her personally, had this long conversation about academia and professional comportment, and she said, I am who I am. I said, well, you can be who you are, but then you're not going to get back in the clinical and you're going to fail the course. So we do work on that, but it is probably one of the biggest challenges that I have seen in the last probably decade of getting people. But look at our society. I mean, look at how people react to one another. This is not isolated to nursing students. This is how, I was telling somebody I passed someone, and I do speed, but I was passing them. I'm honest, I have a V8 engine, Jeep, Hemi engine. So I like to be able to pass, but the person was going slow, and I passed, and the person came behind me, you know, making faces, trying to get by me, gestures that were kind, and I'm thinking, I just passed you. What caused this kind of rage? What caused this kind of behavior? And I've seen this over and over again. So I think any kind of guidance, I mean, this is where we can partner. When you see these types of things in the clinical realm, get in touch with us. Don't think of it, especially instruct your student or your staff to tell us. We need to know this because we do meet with the students. We do talk about comportment. We do talk about what is expected of you as a professional, period. But it is a challenge today, and there's this sense of you're asking me to change myself. And I'm saying, yeah, I am, okay? I change myself every single day. I learn something about what I should or shouldn't do every single day. I change. You've got to do that as well. You've got to figure out what's good about your behavior, how you're impacting, because you could be dangerous being this aggressive in a clinical site because people might be afraid to tell you. They might be afraid to point out that you're doing something wrong. So it does take some energy, but it is definitely an issue for us right now.
Well, and I mean, it's not just on the academic side. I mean, we have to address it on the practice side because those 7-8 years are now the people caring for our patients.
Right.
And I think as leaders, we can't be afraid to have those conversations, which are hard. Those conversations are very hard. So being able to teach leaders on how to have those conversations and not being afraid that that person's now going to not show up for their next shift or decide not to work because we're under this
Right.
pressure of making sure we have not vacancy and shortages. And I think what I believe I've learned and our leaders in my organization have learned is that it actually builds better teams because if it's addressed, the other team members see it and take notice and know it's an expectation and that that's what we should be doing. And our patients and their families expect that. I'm pretty sure. I mean, I'll admit it. There's times where I was not my best self in my career, and I think it's important for us to share that with our newer professionals, whether they're second degree or not, to say we've all been there. But to your point, we learn every day. We have to change. We do things differently. I've known many people in this room for many years. They've seen me at different points, and good, bad, and some ugly. But I think we have to role model it and share it.
Well, and that's professionalism, right? To be adaptive. That's kind of the core to it. But I love that Judy called it out.
Because we have perfect staff, see?
I know. I was gonna high five you, but I didn't think that was really the thing to do here. But I will share that we have a skills lab, right? We have a little tiny skills lab at Central, but our students, when they walk into skills lab, it used to be kind of like, oh, this is so cool. We get to do skills lab. What a fun day this is. So, okay, it could be great. But we now call it Central Hospital because I get to, so I named it. And so now it's Central Hospital. And when you walk in there, you better be all in your whites. Your hair better be pulled back. I know you just paid for the extensions that are beautiful that are down here. I don't even know how you sit that long, but I appreciate it. So pull those up. We had a student come to me. She, oh, bless her heart. She goes, oh, Dr. Slick, my nails. I'm like, yes, your nails are beautiful. And she said, I just had them done yesterday. But we start clinical in the lab on Tuesday. And I said, yes, we do. Let me see how beautiful your nails are. They were beautiful. They're beautiful burgundy. And I said, Julie, I think you're really going to enjoy those this weekend. And she looked at me and she goes, well, it's just skills lab. And I promise I'll take them off before I go to the hospital. I said, oh, no. See, skills lab is the hospital. So you'll need to get those off. She goes, but I just paid for these. Yes, you did. And I bet you won't do that again. So she had to take them off before she went into clinical. I mean, these are the professional things, but these are the kind of conversations we have to have to these kind of degrees, not just about be nice. Don't talk about all the other things in your life. This is not General Hospital, right? But it's things like that. So it is a life's journey. But I think, you're absolutely right to call it out, because we talk about wraparound services, all the things that we do to help. I would say within that, and I know this of my academic partners here in the room, we are also teaching the professional piece and expect it. And if they don't do it, they don't get to do the next thing. I've removed people from clinicals and people look at me like, whoa. I'm like, if I'm not going to do that when I show up, you can't do it when you show up, even though I was pretty young and dumb too. I just didn't let everybody know it when I did it. I knew the right group to do it in front of, I guess. Anyhow, I think but it's a great conversation about professionalism. And, our students will emulate what they see. Oh, they love it. And they love to come back and to tell you, but we saw it this way. And I'm like, that's interesting. That won't fly everywhere. So we talked a little bit about professional partnerships, or we've talked a little bit about it this morning, and the partnerships with not only between academia and the hospitals, but also talking about, GCONL is a wonderful organization in the city. I don't say that just because I'm very close to Ashley Carlucci as I stand here, and Jude, who is here as well, but saying that it has been a powerful organization for a long time in Cleveland. And I think, Pat, that's one of the reasons why we have the dialogues that we have in our organization or in our city, the Center for Health Affairs. But how do we see how professional organizations can help us with the support and the partnerships to help support our students kind of moving forward? And let me see this way a second. How can we help our early nursing students and our early nurses understand the power of those organizations and professional development? If I don't see Becky Patton, she's not here this morning, right? She taught me this in my classes and how this is important. But I'd like to hear from you all, like what you feel about the professional organizations, how we can bring that back to nursing a little bit more, and our staff nurses and our students.
In hospice, I think most of our nurses aren't participating in any of those organizations, I don't think, but they're enrolling and participating in national hospice and palliative
Great.
care organizations and certifications and publications. They kind of go down that track versus nursing in general, but
So in their
it's-
specific professional organization.
right.
Sure.
It's kind of my professional soapbox. My colleague Mary Beth Modig's here, and we've talked about it for decades, that it's just kind of an obligation to join. I've kind of switched how I sell it to newer nurses or newer into the profession again, whether it's they're right out of college or they've pursued nursing as a second career, is that it's kind of your healthy professionalism. It's not about time or money or this balance piece. That's going to help you feel more healthy in your profession because you have a network, you have opportunities to discuss some of the challenges, you learn about how people are conquering challenges, and you get involved in a different way. And it helps you with that balance because you're seeing different groups and different folks. I think, and it's bringing academics and clinical together to then think about what the future looks like. So it is, I always tell people, it's one of the first things you should do as a nurse. Find one, find five. They'll change over your career and what you're doing. And I just think it's really important because we can build exciting stuff. I mean, the stuff coming out of ONL with the apprenticeship stuff that they want to take to the board. I mean, that's really important stuff for all of us that we need to, and we can be active in changes that need to happen at the state level, maybe the federal level, whatever it needs to happen. And, I always say, we'd love to do things, but there's some red tape that we come into that things aren't as easy as Melissa and I have learned in trying to do some innovative things. But we have to then go to the organizations that have the power because it's not Melissa and Meredith coming from John Carroll and Cleveland Clinic, it's the Greater Cleveland nurses leaders saying we want to do something different.
Power in numbers. Many voices, yeah.
Yeah. Do you want to talk about some of the work that you're doing now?
Yeah, I mean, I'm a huge fan of professional organizations, and I know my colleague here, Pat, being the NLM president, probably has a lot more to say on this topic, but I've always found professional organizations to where it is the empowerment of the nursing voice. I mean, I went to my first DMP class now, it's been, 2018, and Dr. Joyce Fitzpatrick humbled me immediately and was like, how many nurses in the US? Does anybody know? Yeah, how many in the globe? 20 million. Like, how impactful we can be if we come together on an issue. I think as nurses, we haven't been as inclusive, I think, as we'd like to be as a profession. But this is where we can find, I think, a common voice. We can empower each other. We can make a difference. And for me, if it wasn't for my, OONL Legislative and Practice Committee, we became a part of the multi-licensure compact because of that work through OONL to make that change here in Ohio. And that was a really impactful experience for me. And so now, as I run into rules in the OBN that maybe I don't see eye to eye with, or other things that I think need changing, there's, you take it to groups. We've got several groups, I think, that have impact and perceptions, right? And opinions, right? And if we can come to the collective, then we've probably got a really good solution and can take that forward. And that's the power, I think, of our professional organizations.
I think it's great. And I think I was in that class with Melissa, and I saw her eyes get really big, and she's like, oh, this is cool. And so she, and you could see the spark come in to her immediately with that. I guess my question is, it took you to your DMP program, right? Now look, you were always kind of a rule
Challenger.
Yeah, skating the edge of the rules, which is fine. But it really allowed you that platform and gave you that permission. I'm interested how you think we ignite that passion earlier for our students, our newer nurses, because they're not joining clubs.
Oh, they are, though.
Well, our Student Nurses Association is pretty strong, I will say that. So we've done that.
Through the Student Nurses
Yeah.
Association, we have about 60 or 70 students that are
Yeah.
part of the National Student Nurses Association now, plus many more that are part of our student nurses. So to dovetail in with Meredith, what you had to say is engaging students pretty early in organization, and they get the opportunity to be delegates and present changes to rules and identify ways to impact policy while they're in their nursing program. And then if they can do that, I think another big thing would be exposing them to GCONL, having meetings where students are actually invited into that role, because it gives them a sense of, okay, I'm a leader. I may not be in an official manager or leadership capacity, but how do I think of myself as a leader? So being involved in those, including, I know our students go to some of the nursing education programming, but finding opportunities to really see, oh my God, I'm at a meeting with Meredith.
It is kind of touch the road.
It is.
Yeah,
It's like, can I
cool.
touch her jacket on the way back? And Rob, she is Cleveland Clinic's, CNO. And so it is really important to our students to have that kind of contact. And it means that to all of you. I mean, you're all leaders in this room, and I don't think you understand the halo effect that you have for our students. If they see you doing that and they see a staff nurse doing this and being involved, then they'll be interested. Me as dean means nothing to them. I'm just the dean, all right?
I have to share one quick story because it just the end of it happened yesterday, not the end of it, but part of it happened yesterday. So this is going back to the summer of 2020, and I met with a high school junior, going to be a senior, who was very interested in nursing. And she knew her stuff. Like, she knew where she wanted to go to school. She knew what she wanted to do. And then, as we were talking, She says, I want to be you one day. Now, most of us would be like, come on, you're 17. How do you know you? She's like, I want to be the chief nurse of a big place one day. And I said, God bless you. Like, you know, but to know, like, to think about that she was brave, and it wasn't unprofessional. It was just, I want to talk about this, but that's what I want to do. And I was like, you know, many people could have been like, easy, just become a nurse first or get, you know, like, but no, I was like, great, we'll get you there. Okay. Just yesterday, she emailed me. She started at the Cleveland Clinic as main campus as an ED nurse, and she's so excited. She's having the best time, and she's like, I'm going to keep in touch. But like, but that's great. But like, to hear from her yesterday, to be like, I'm done with school. I mean, I heard from her in the spring about, or that she was applying and gonna, you know, where she wanted to work. But like, go get them. Like, everyone find that person. Like,
Yeah. Like, what amazing
chutzpah. I was
chutzpah.
like, I'm gonna come find you and give you a big hug in the emergency room.
Like, I want to know you, right?
Yeah,
I want to know how you could be so motivated at such a young age and know exactly what you want to do.
Yeah.
How many of us in this room knew we wanted to be exactly where we are right now?
So.
Right.
She'll
So
be
I mean,
sitting
it's
here
kind of
one
cool. I guess here's my other piece to this question. So we've heard from our academics. I started my own Student Nurses Association because we don't have them in LPN schools, and they're not recognized by the National Organization of Student Nurses Association. But that won't stop me. So we're going to push forward with that, but that's okay. So my question is, knowing the other side, knowing the workforce side and the healthcare platform, right? So now the hardest job in any hospital is what? A nurse manager. Hands down, oh my land, the hardest job ever, because you're managing just all kinds of stuff. And I know that there are healthcare organizations that require that our managers become certified, because it's the right thing to do, or that they have, or they become a member of an organization. We want them to do that. And so I feel sometimes, I'm going to throw this out there and you guys can tell me what you think, but I think sometimes that's a check box. I've done it because you made me. I did this, I joined this organization because you made me. But they don't always get to see the benefit of their membership and translation into something that they then can do. I guess that would be part of my challenge, right? So from a GCONL, how do you lean back in to the nurses within the health systems and show them their power forward? Because they almost need to see that rather than just the calling to go do it or the calling to become the CNE of the Cleveland Clinic someday, right? Because not everybody has it. But if you can ignite that power in someone, I saw it in Melissa's eyes. They gave her the okay to do it and to forge ahead. And it's been powerful for you. Fair?
Fair.
Yeah, so I guess that's, look, you didn't know I was going to give you homework, but I think that's one of those things, like, how can we do this for our nurse leaders and the people that are in our organizations to ignite them to see the power that they possess, rather than just a checkbox that now I am certified and now I'm a member of the organization. There you go. Oh, didn't know I was going to do that today, but I did. All right, we have 11 minutes and 37 seconds. I have my timer. I just want you to know, because I'm not really good at staying on time because I could talk to you all day, but I want to make sure that we get a couple more things in. And we're going to talk about workforce development and career pathways. And then I also really want to talk about the future of nursing education and policy recommendation, because I know that you guys have alluded to some of those things and some of the work that you're doing. But as we talk about workforce development, let's see, how can nursing schools and healthcare organizations collaborate on work solutions? Now this is funny because this isn't written right. It's LPN to ADN or LPN to RN transitions or new graduate residencies. We've touched on it a little bit, but I'm just wondering, Pat, if you want to talk about some of that, maybe some of your thoughts, and then Melissa, I want to talk to you about the OBN and some of the things that you're proposing.
Absolutely, thank you, Erin. A couple different things that we're doing relative to academic progression. One, as part of the NLN, I am chairing a committee with Pamela Jeffries, who's the dean at Vanderbilt, and a team of pretty intense deans across the nation regarding academic progression, because we have not been really good in academia about recognizing prior learning experiences, about really reducing the barriers for getting our students from LPN to PhD if need be. I mean, we have some great leaders out there who were GED to PhD. So we want to make sure that we're doing that. So there'll be a vision statement coming out from the NLN that will be addressing this and taking away some of those barriers. But individually, you know, Erin and I have had some conversations about LPNs, not realizing that LPNs have a lot of barriers to prior learning experiences and any of the education they had in their year in LPN school. So we've been working with the NLN to identify testing and some programming that we can do that will give them prior learning experiences. Not that they're spending a year taking prerequisites before they actually get into a program. Also noting that those students don't necessarily have the capacity to move from LPN to BSN all the time. They really have to go stepwise, and that's okay. I mean, from our perspective, it is. So how do we create a program where students can go from that LPN, take care of what that 1 year had in it, even though it doesn't fit into our Carnegie units and all the wonderful things that we have as sacred cows in academia? How can we work that through our faculty, get them credit for that so that they're maybe spending 18 months to becoming an RN from the time they start the program? So hopefully we'll be able to get something like that moving, because to me, as a diploma graduate, I had a lot of barriers. I mean, I'm an old diploma graduate, so that meant I repeated my 4 years. It wasn't an RN to BSN program. They called it an RN to BSN program. God bless Ursuline, my alma mater, but it was 4 years of going through test outs and actually processing, taking things over, and I was the vice president of operations at the time, and so it's how do you get to that level? So I think my heart is very much into how do we reduce those barriers and really improve academic progression so that we have a constant our workforce. When you're talking about pipeline, getting students into that pipeline, we can pull people through into that LPN role, into the RN role if that's what they desire, or maybe they just want to be in the LPN role, which is just fine too. Finding that niche though, and not putting the barriers to allowing them to move forward or advance their education is really key right now.
Great, thank you. I just want to say too, we've been spending a lot of time talking about models of care and what that looks like, and you know, what is old is new again, and bringing LPNs back into the acute care setting, where many of us, when we started, we had an LPN. I had an LPN that oriented me at Cuyahoga Hospital, and I'll tell you what, she was amazing, and she taught me so many things that the RNs didn't teach me. And then, you know, all the things happened in the late 80s, early 90s, and we didn't have LPNs at those spaces anymore. And now we're seeing through different models of care that you're all bringing forward that now LPNs are coming back into the acute space. Understand an LPN can't do everything, so don't put them all in the ICU. Sorry, just my little soapbox. Please don't do that. But if you want to talk about some more of the models of care, maybe, and then I do want to talk to Melissa about what you're doing with OBN. So go ahead.
Go ahead, Wendy.
Yeah, please, Wendy.
Well, so just before I can talk about our career ladder, but I do want to say in the state of Ohio, we are fortunate that we do have the CTAG and the ITAG opportunities with workforce. Those are through the state of Ohio, where we have industry recognized credentialing for LPN is one, because that's what we're talking about, where we do have the opportunity to give credit for LPN work experience, but also education. So to Pat's point about the barriers being removed for LPNs to move on in their education. So that was just something I was thinking about. At Tri-C, our program, our curriculum, we have a career ladder. And so talking about models, the way our program is designed is that students enter into our prerequisite coursework through the ability to have taken a course that allows them to have the ODH component, the Ohio Department of Health component for CNA. They just changed from STNA to now CNA. So they are able to get that certification after completion of the course. And once they enter the program and complete our first year, they're able to sit for LPN licensure. So as Erin just mentioned, LPNs are now back on our floors. And so after that first year, students can sit for licensure, and we have seen that number increase. It has doubled just in the last year of students who sit for that licensure. Our pass rate there is in, I think for 2024 was 96% of LPNs, and they're working. Shout out to Metro Health. I encountered a young lady. My dad was there over the summer, and she said, yes, they hired me here, and then she went on. She finished that last year, so that's the last leg of our program. They come back, finish their third and fourth semester, and then they're able to sit for RN licensure. And so she said, I came back, I finished, and on this same floor where I worked as an LPN, I'm now an RN. So that is our model, and it's, you know, it's a shout out to Metro Health because my dad was there, but all of the hospitals across the city are doing a similar thing. But the point is that that ability for students to have a trajectory, and our program is set up that way. It gives them that ladder, but it also gives them off ramps if things happen. When we go back to, we talk about resiliency and things, and things that happen with students along the way. But that experience, so okay, now you've become a CNA, you have an opportunity to work now in that capacity and get experience working with patients, talking to patients, having those connections. You are now in the program and you're having fundamental clinicals and you're doing things and you get stronger in those skills and that professionalism that we talk about. So you're building on those skills, and now you've gotten through and you sit for LPN licensure and you have an experience and you take NCLEX, and now you're working as an LPN, and we work with you to work out your school schedule so that you can continue to work as an LPN. And so now you have that opportunity to be an LPN, and now you're a nurse and you're a part of that culture, those comments that I made before, and you're here and you're working, and now you do 2 more semesters, and now I sit and I'm an RN. And so that is the way, and we've seen it, and it's working tremendously, and many of you are reaping the benefits of the graduates of our program. So that is our model.
Wendy, I love that you call it off-ramps. You know, somebody else called it failing forward, right? You're not failing. You just, you know, you're falling up forward and you're continuing on, right?
Because
But
they
I
can
love the
always,
off-ramp.
yeah, no, because they can come back and continue and come back on the ramp and continue on, and that, no, it's
Yeah, I
not
love it.
failure. No.
Yeah, I love it. I love
And
it.
I
I
don't
love it.
like ever using that term.
I
know
don't either.
we throw it around in academia all the time, but I always like to say it's an unsuccessful attempt.
Yes.
Because, you know, I think Pat said it before, they quit in their minds so easily. And we want to see students successful, and they really look at us as out to get them so often. And we're not. And we want to be their biggest cheerleader, and they don't see us in that way. And so sometimes it's just about what you say and how you say it and the terminology that you use when you're having conversations with students. So, you know, as the dean, when it comes to me, those conversations are pretty heavy. So you learn to make it as open and honest, but giving them some dignity to be in a space that they know that we're there for them.
I love it. I love off ramps and on ramps. Those are going to be new things that I bring into my conversation. I love it. We have about a minute and a half. Melissa, I know we wanted to touch a little bit on some of the legislation that you're bringing forward. If you don't mind
Not
highlighting.
legislation, but hopefully rule changes.
Oh, look at me. I'm
the
all
Ohio
about
Board of
legislation.
Nursing, the nursing education chapter is up for revision in 2026. And so I think it's a good time for us to take a look at what do we think the qualifications need to be for program administrators, clinical instructors, preceptors, you know, what do some of the rules need to be around educational systems and who's qualified to do things. So I've been working with the Associate Dean Group, the Bachelor's and Graduate Dean Group, also OONL, to make some rule proposal changes. And so I think that make a lot of sense, just related to a lot of the demographic changes we have in nursing, as well as we're talking about the experience you have and how we begin to bring experience into some of our qualifications. Sometimes it's not just degrees, right? But how do we encourage sort of that growth and development in academia as well as other areas? So yeah, more to come on that. But again, using the power of groups and professional organizations to get input and really bring something forward that I think can be considered for some rule changes.
I think it's great. I think, I don't know how many of the people in the room would say, boy, I'd love to teach, but boy, I'd love to do this, but, and I think that's part of this, right? And I think we all have those stories about, but maybe we could do this. So I look forward to what that's going to be. First, I want to thank our panel, but we want to open this up and see if anybody else, if we've spurred any questions, any comments from anybody in the audience. I am happy to walk and talk and bring my microphone to you. Yay. So please tell us your name. And I don't know, anything else you want to say? And then ask a question.
Hi, everyone. This has been great. Oh, thanks. I'm Melinda Carabello. I am an assistant nurse manager at Rainbow Babies and Children's, and I am a current student at the Mary Ann K. Shaughnessy Nurse Leadership Academy in the master's program. I wanted to make a quick comment about the professionalism piece. So my coworker Kim and I, part of our role at Rainbow is we help to oversee the PCNA float pool. And I think talking about professionalism and seeing what we're seeing, it may be beneficial to develop some sort of residency program at the unlicensed personnel level before they're getting to your programs and tapping into those barriers that their home lives and their challenges they're facing before they get there, and help to develop that professionalism among that group before they get to their professional goals. We see that a lot. So we have talked about suggesting that at UH, I think that's something that we could talk about. And then I did have a question. One barrier we're seeing with our nursing staff at Rainbow is, especially our newer nurses, is the challenge of having them heed our advice or taking in any education we're providing. So for instance, our educator who's been there for years and years and years was something as simple as helping them troubleshoot a leaking IV. And collectively, the nurses all agreed, oh, we're just gonna pull it, with no extra thought, no further investigation, and she felt like she was beating her head against the wall. And we often feel like we're just kind of lecturing, but they're not really taking the advice, or they're just deciding to do something else. Do you have any suggestions that we could tap into to help them see the value of what we're trying to guide them towards and understand the importance of detailed documentation and why it will ultimately protect them?
Oh, if you have that
Sorry, I had a
answer,
lot to say.
you've won the prize, because I will tell you, it is a struggle getting student, well, anybody anymore, but students specifically, to see what we're doing is not punitive but restorative. We want them to do well, and in fact, the issue regarding professionalism, the focus was not on dismissing them from the program. The focus was on how do we get you to where you need to be. So we do a lot of that. I mean, everything, even our performance improvement plans with students is geared toward what can you do to improve your performance? How can we support you in this? And then we give them counsel about, how do you take this kind of constructive criticism and run with it? And it is a struggle. I don't have the full answer to it. I don't know if my colleagues do, but definitely it's been a challenge for us to get, not all students, obviously some students are more than receptive, but getting some students to the fact. And again, I'll go back to the fact some of that is imposter, and they get a barrier and they shut down and they feel like they didn't belong here before, so they're going to push back. I mean, all the research on belonging and feeling like you belong in the atmosphere you're in tells us that as soon as they hit one barrier, they're going to put up a wall. And they're going to say, I'm not going to listen to this. I'm obvious. And they're going to push back at you. They're not going to say, I don't belong here. It's your fault. But it's really internalized that it's them.
I mean, I think 2 opportunities, peer-to-peer review, so more peer-to-peer. We're talking a lot about how our program exists, but it's probably not in terms of the most robust. And then more clinical kind of reasoning rounds. So it's not in having peers just talk through like, how do we get to this decision? Or what do we think we should be doing differently? Or how could we make a better outcome? I think for your first question, the answer is yes. And I know I'm very proud to say we're already doing it. So we've completely revamped our unlicensed onboarding, and it will go to a residency type program. We've identified the foundational skills that have been used for other programs in our organization, and using that as the basis for that and those expectations. And then very proud we have a very strong experiential program called Magnus that the leaders here that we've done for nurses for over a decade. And we have now started doing it for our unlicensed folks. And so it's an experience for them with their peers from across the organization. And it's powerful because, I think we always talk about academic progression or career progression, but there are individuals that want to do what they're doing, and they want to stay what they're doing, whether it's a bedside RN, a PCNA, assistant nurse manager. And so we need to, respect those pros and place and develop them. And while it was a very small, but it was a powerful group, and we want to continue because hearing from them and, what they want to experience in their roles and how they want to take good care of patients, I think we can only replicate that more.
Great, thank you. Thank you for your question.
I just want to add, I think as you guys are talking, I'm just thinking like this area of professional development, I think is an area where academia and practice can really come together to tackle this. Like I'm thinking, is this an opportunity for academia to even have a transition program, even though we've had the residencies program, but this is where an academic faculty advisor stays on in that first year transition to be the peer mentor. I have all of you coming in now to academia to do guest lectures when we need experts to come in. Is this an opportunity for academia to come into practice on communication, professional development, or advising, mentorship, teaching principles, because that's changing rapidly, competency-based education, so I'm putting it out there. I don't have an answer, but I'm wondering if this can't be where we come together more, where we look at too, maybe even though they've graduated, maybe that's not where we let them go, right? Because I'm wondering, if I was a faculty advisor and I've known that student for 4 years and they made a mistake, right? How much would they feel safer having that conversation and be open to the feedback there? I think the peer-to-peer is huge too, but I also wonder if that would feel a little bit like that wall. But how do we work together? I don't know, but that's a thought, maybe something we can explore.
I love that. And see, we have other homework assignments, other
Yes,
things to
I
do
wrote
to
it down.
continue the collaboration conversation.
Hi, I'm Kelly Gilhausen. I'm the nurse residency coordinator at the Metro Health system. Oh my gosh, there's so many thoughts going through my head. First of all, really quick, we actually do that with our PCNAs. We have modeled our PCNA program after my nurse residency program. So they get their training, and then they come back for professional development classes specific to that role. So it can be done. I think as I'm listening to all of these wonderful thoughts, and thank you for everything you've shared. I have some things going through my brain. I am also an old diploma school nurse who advanced through and got my doctorate, so I took the long road, but I got there. And I think one of the things that was addressed was the professionalism in nursing, and I agree. But what I see really with the new nurses coming out is we are doing orientation in our organizations the same way we were doing it 30 years ago when I started as a nurse. But really, I don't want to say the quality of nurses, the experience of the nursing students coming out of nursing school is different from what I had. I was in clinicals 2 to 3 days a week, 8 hours a day for 2 full years. It was very different. And I don't think we can do a cookie cutter approach where if you're hired in this unit, you get 6 weeks, in this unit 12, or whatever these arbitrary numbers are. I think we really have to really focus on the competency. And you kind of touched on my question is how do we work together to develop this professionalism, to develop the understanding that joining a professional organization and nurses having a voice is so important. So how do we work together? You did mention that you had some guest lecturers come in, which is great. I usually start my nurse residency with, hi, I'm Kelly, I'm your nurse residency coordinator, and if nobody told you, you're gonna work nights, weekends, and holidays. Because sometimes that in itself is a surprise. You know, they're like, well, I don't wanna work nights. I'm like, nobody wants to work nights. Well, some people do, but. And so I think there is a way for us to connect and collaborate where you coming to us, which I love, your idea of staying on, because you're right. You guys have these amazing wraparound services. You've developed and built that trust. They don't have that yet with us. And although we're trying to develop that trust and that relationship, having a bridge from one program to another, I think would be very, very good as a way for us to really, truly provide that wraparound service. So I like that. And I guess I want to know, how can you envision as academia collaborating with healthcare organizations to have these discussions, to talk about professionalism, to talk about, you know, all of these things that we're talking about today, because I think we'd all love to partner with you, come to your classes, come and talk about these things, how things work in the real world, which is a little bit different sometimes. And the other thing I want to say is, I don't know if anyone else has experienced this, some of the new nurses are coming in a little jaded already. And I think too, as nurses and for our colleagues at the bedside, they're emulating that behavior that they see out when they're doing their clinicals. And we need to do a better job of portraying this profession as a gift and as an art and a science, and it's hard, and there's gonna be hills and valleys, but we need to continually bring it back to why we chose this profession. And we need to continue to reinforce that over and over and over so they don't start off their career jaded, because that's a really hard hill to overcome. So any thoughts you have on how we can do that better? I'm open.
Pat, wasn't there, I remember this when I was on the clinical side, I felt like you and somebody else had like an academic practice group where you were bringing.
Called NEONI.
Yeah, is it?
This is it. I think it was in this room or somewhere, yeah. It was.
I mean, I remember that, and then COVID hit, and I think it just went away, but maybe it's an opportunity to revitalize where we bring, academic institutions as well as practice institutions. And I think we've got to broaden the scope, not just acute care, but, I think about home care, I think about insurance companies. I'm going to be putting some of my nursing students in different facets of healthcare to understand that. But how do we bring a broad swath together, do some pilot programs? So maybe it's, maybe we pilot this with one school and one hospital on I'll call it a mentorship program, but I think do you think that would be the avenue to revitalize that, Pat? I mean, was that
That, I think, is up to the Center for Health Affairs, but
Ryan?
But I think it was a good opportunity because a lot of people came there. It was a chair and vice chair that was, it went through GCONL.
I said it could go.
Could go through GCONL.
GCONL,
yeah.
I think it was a great opportunity because it wasn't just the deans and the CNOs. There were
Right.
lots of people that were part of it. And the discussion was significant between practice and academia. Plus, it did permeate. We had groups that would meet. I think, Nancy, you were on the education group. I mean, there were several of us that were on different groups.
Mm-hmm.
I think what Melissa has to say is we have to think of the students and the practicing nurse on a continuum.
Yeah.
We can't think of them as, we have a silo of education, they graduate, we hand them off. Because to me, the reputation of my graduates is so dear to me. And I want to make certain that they are giving this region what they need in terms of healthcare, that we are being responsive. So we do have that kind of dialogue relative to our curriculum, relative to guest speakers, like Melissa mentioned, but it would be really nice if there was some way, and I think that's a very innovative approach for us to get into your areas as well, because I do think the relationships that we build over time makes a difference with the students. And they do, I mean, especially by the time they get to senior. You know, you've got those first 2 years where they look at you like you're an idiot. And then finally, when you're getting to the end of their time, and they're suddenly like, oh my gosh, this was a phenomenal education, thank you. But they don't get it until just about graduation. Some get it long after that, but most of them get it by the time they're
Pat,
seniors.
I'm sorry, I love this conversation, right? As nurses in a continuum, they start out as students and then they get to be nurses, right? So that's amazing. Sounds a lot like a patient population. See how I just dumped it? Yeah. Anyhow, so that's awesome. I think one of the things, and Pat and I were talking about this the other day, and I kind of went, oh my gosh, you're absolutely right. The things that we were allowed to do in clinicals when we were in school was a little crazy. Actually, it was really cool. It's how I learned the things I learned, right? I went to Kent State's ADN program, and I was thrown into rooms, and you better roll up your sleeves and get into it. How many of you know that nursing students, and maybe not in everybody's organization, but in many of the organizations that we go to, they're not able to do glucometer checks? Isn't that interesting? How we allow them to do phlebotomy, we allow them to put IVs in, but we don't allow them, because there's a rule there somewhere, right, that they can't do a glucometer check. I know. It's one of those kinds of things. We need to look at those kind of things. What are the barriers that make that not something that we can do? Because we would tell you as our students, go for it, go do it. It's not a silly thing to be able to do, but it's a thing that, like, I'm letting you put an IV in, but I can't let you do a glucometer check. It seems kind of counterintuitive. So it's things like that we have to talk about too, because we want to prepare our students as best as we can with all the things they can do, but it's a barrier that we don't know why it's a barrier, but we have to walk through it. Anyhow, we have another question. We have so many questions. How much more time do I have? Jack? Because I left my timer. 5 minutes? 5 minutes?
All right.
That was generous, Jack.
Well, good morning. My name is Gina Singleton. I'm an imposter. I'm not a nurse. I'm actually a lawyer. But I know. Please
close that at the door.
I know. But I've had the privilege of being a nurse champion in my entire career. I serve as the general counsel for the Ohio Association of Advanced Practice Nurses, Ohio State Association of Nurse Anesthetists, and Ohio Council for Home Care and Hospice. So I guess my question to all of you and maybe the panel is, are there resources that our trade associations in Ohio can provide to either your students or your educators to help this transition to practice? Are there educational sessions that would be helpful, other sorts of resources? We're always looking for new ideas.
How much time do you have? You did it. Panel?
I think, go ahead.
They're
No,
all-
I think it's what we just mentioned,
Yes.
bringing whatever group together.
Right.
And then we establish whatever actionable items around professionalism and transition to practice. And then we can develop some of those working groups and then determine what resources that your group and your colleagues can provide. Because I think that that's a gem there, that we could definitely establish some things that we could tap into you and your group. But just stay tuned on that, because I think what we're proposing is important, and that group, that working group, because it is a working group. So often we get together and we just kind of talk and pontificate. But this work, nurses, we know how to work, right? And so this is about doing the work that Kelly, just so clearly articulated and outlined that we need to come together and do, because it is about bridging that gap that Melissa talked about and that continuum that Pat talked about. I think there will be a time that we will call upon many people for resources. So yes, stay tuned. Thank you for your question.
And I ask all of you to remember that, the future of healthcare is not going to be in the hospital. I mean, we're going to need hospitals, but it's home-based and it's community-based. So don't forget that, the relationships that
contingent.
we need, the kind of organizations home health and hospice need for these relationships. Don't forget about us, I mean, because we need you.
Yeah, and I would just further put a plug for those of us that started our careers more than 30 years ago, and we were working with LPNs and RNs. Now we have a whole contingent of people that never worked with an LPN, so they don't understand their roles and their responsibilities and how they can collaborate together. And oftentimes it becomes, they talk about a legal implication for the RN. And so I think if we can help address some of that, and I know that every organization in their rooms tries to discuss how that really works. Boy, wouldn't it be nice if we just had a statement? Oh, sorry. So you could help us. Look at that. We could keep you busy.
Erin, you have
Certainly.
some-
Do you have a
You
question?
have
for
some
me?
hands over.
Oh, I'm sorry. Hands over here.
Yeah.
I'm moving in the room. Thank you.
Thank you. So my name is Mary Beth Modick, and I have the good fortune of knowing many of these wonderful people up here. So I just want to say I'm a testament to what Melissa was saying about academia and individuals influencing you after you graduate. So once I completed my DNP, I had the formidable Dr. Joyce Fitzpatrick as my mentor. And I went to the then Kelly Hancock, who was our chief nurse executive, and I said, I want to bring Dr. Fitzpatrick's leadership course that I took at a graduate level to these group of clinical nurses that I have been working with for 4 or 5 years. And she said, okay. She said, let's negotiate that. So Dr. Fitzpatrick came for 18 months and facilitated with me 3 different groups in which we created what my dear colleague Meredith Fox was speaking about, called Magnus. It's a clinical empowerment experience. It's not a class, it's not a session, it's not curriculum, it's an experience. And we speak about professionalism and how we know that 10% of people are nurses are not members of organizations. We talk about person-centered language. What does that mean? When you're interacting with a person who has diabetes, they're not diabetic, they're not compliant, they're a person. Talk about appreciative inquiry, how we again change perspectives to problem solving. We don't use the word feedback, we look at feed forward. So when you have the opportunity to encounter a patient that you're admitting from the OR again, from the PACU, what are the things that you're going to concentrate on? Not let's debrief and figure out what you did wrong. So it's a complete paradigm shift really in thinking. Presented distilled portions of that for nurse managers, and then the PCNAs. And again, when you talk about women who have been so marginalized, or what they have done just to be a person and be a PCNA. And many of them say, I wish everyone knew that I loved this work. I don't want to be an LPN. I don't want to be an RN. I want to continue. I want to be better. And I think, again, it reminds us of the generosity of spirit, the intentionality, the goodness and the kindness. And it's, again, an experience where these women have the opportunity to tell their story, practice reframing, practice collegiality, practice reaching out. And we just finished kind of a graduation where they actually brought a nurse colleague and had some dialogue. And 2 of the PCNAs who never, ever, ever would have gotten up in front of a room spoke so eloquently, magnificently, compellingly about what this opportunity meant to be able to be heard and to speak up. And so, I'm grateful for the education I've had and for the influence that these lovely people have had on my professional career. But we need to be thinking about affirming and validating. We know the work is tough, and we need to create situations that people can thrive, and we can continue to acknowledge them. So thank you very much.
Thank you very much. All right. I will take one more because I have the mic and they haven't told me to stop yet. Chris.
So thank you, Jody, and the GCONL. So I'm Chris Young. I'm the Chief Nursing Officer at Akron Children's, but I'm also the president of OONL for the next 2 years. So this has been amazing, and I would love to bring this to the state level so we can really strategize around the state of Ohio, because like you alluded to, there are power in numbers, and we need to think about every healthcare setting in the state of Ohio, because we have some rural settings as well in some of our chapters that might not have the opportunities that we do in Northeast Ohio. So whether it's through Greater Cleveland or NEONL, which is the chapter that I'm a part of. So we'll likely be reaching out to some of you to see if we can do something at the state level to bring this topic to the top of our priority list. We'll be doing strategic planning in the next couple of months here, and I'm already kind of brainstorming about how do we bring our academic partners into that process, because if our top priority is workforce, which is what it's sounding like, we have to partner together. So thank you for this day. It's been great. Thank you to GCONL for putting it on in the Center of Health Affairs. So thank you all.
Boy, you're really good at that. That was good. Nice job. And I would say that I'm sure our panel would love to continue because we've had a lot of fun planning this. I'm going to hand it over to you in a second, but I am going to thank my colleagues for the conversation. And thank you all for bringing your authentic selves forward and letting us know what is in your heart and the things that you're working on and how we can better prepare our profession, or what I call now our patient population of nurses. I know you're all going to leave and think that, but I will pass this on to Jody. I want to thank all of you in the audience for your comments, your thoughts. I hope this is spurred just a little bit for you to think a little bit differently, and certainly to thank GCONL to having us, walking right in front of that, and the Center for Health Affairs. Thank you so much.
For those of you who don't know me, I'm Jody Blessing. I'm the president for GCONL. So on behalf of the Centers for Health Affairs and the Greater Cleveland Organization for Nursing Leadership, we want to thank our esteemed panel for sharing their time, their experiences, their wisdom. Thank you to Erin for moderating this discussion, driving this engaging conversation, keeping us on track for time. Always a challenge. Thank you to our sponsors for supporting this collaborative event between our two organizations. And then finally, thank you to all of you for joining us this morning, participating in this event, sharing your thoughts, your questions, your ideas. It's been an engaging conversation. Please watch your email for an electronic survey. We welcome your feedback. This has been our first collaborative event. We are very excited to consider putting more of these types of discussions on for all of us to learn from. So thank you.